You've had the tough customer. How do you win them over instead of them dropping off your schedule? That's what we're covering inside this video. My name is Dr. Chris Garcia. I help cash-based physical therapists just like yourself improve clinical outcomes, maximize your result, and thrive in business. When you look at tough customers, tough patients, these are people who they want the help. They need the help, but they're just being tough. They're not showing up. They give you a hard time about the price. They don't want to do the homework. And we've all had them. They don't like you. They aren't working with you, but they keep showing up and they want to be helped. And this is where you're torn as a cash-based physical therapist. In insurance-based care, they would have been just thrown off to the side and somebody would have found them, or an insurance-based company would have taken them somewhere else. So now you're in a cash-based setting. This person's clearly looking for help. They're willing to pay. And the question is, they're paying your amount and they've signed up for 5, 10, 20 sessions. The challenge is they're being tough. They're not listening to you. They don't want to abide by your rules, and they're being a headache, if you can say that, inside your clinic. I'm here to tell you that there's easier ways to manage these people. All right, we have to take a step back before we dive into what is it, the low back, is it the knee, how complex was the history, what was the surgery. You have to understand why people make the decision to come see you, first and foremost. They're looking for a solution that somebody hasn't found, right? So these people are literally asking you for help, but they're putting a front and being angry, they're being frustrated, and you're now saying, well, then why are you here if you don't want to? The reality is that they're looking for love and support, and they just don't know how to do it, or they've actually been traumatized by other clinicians, by other healthcare providers, and they're frustrated. That's what at the top of your head, that's what you have to realize. These people want it, and they're showing up because they don't know how to say it, but they want your support. And clearly they've sought you out and they've paid up front, or they continue to come to see you. Maybe it's a complex case and you haven't been getting the outcomes, but they continue to show up, and you have to realize that. So what you have to do is you have to figure out, why is this person here? And the first place to start is we got to ask them. And this is a cringy question for a lot of physical therapists. All right, so for step one, let's figure out what they want. What's the ultimate goal? What's a realistic goal? And then why they chose you. And once you start here, you have to understand that the person has made that decision. They are what we call a driver. They're a person who is maybe a business owner themselves. They're used to making their own decisions and they don't have a lot of time. So whenever they're with you, they want things done a certain way. Maybe they don't listen to everything you say, but they just keep showing up. And these types of patients, they're fantastic patients because they are willing to make a change, but they're not used to people fighting back or pushing back against them and telling them what to do. They're just not used to that. So whenever you have a tough patient like this, anytime you have a driver, somebody type A, OCD, business owner, maybe even like yourself, the way to attack these individuals and attack these sessions is to hit them head on. Because if you take the empathetic, traditional physical therapy, I want to help everybody with one-on-one personalized care, it's not going to work with these people. These people will run over you and you won't enjoy working with them. So the way you approach these tough patients is you say, hey, I completely understand. I need you showing up on time. I need you doing your work. You've committed to this. I'm in it, but you're not doing your part. And now that conversation alone is tough for people to have, because they're like, well, they paid to come here, so I'm going to treat them. I'm going to give them the best, patient experience and do all these things. But the reality is that's what's worked for them their entire life, and they haven't found that solution. No one has hit them head on with the truth. Listen, if you want to get these results, I need you here on time. You've committed to 3 times a week, and I need you here on time doing your homework, or you won't get what you need. Now, if you're not willing to do that, I'm not sure if we're going to have a good relationship working together. And with a driver like this, with a tough patient just like this, with that personality type, this is what you need to do. And not a lot of people realize this, in that you have to be able to break people up into different categories of personality types, because that's the way you manage them. Their knee or their low back or their neck don't dictate how much pain they're in. What does dictate that is their history, their background, all the trauma they've experienced, which has created their personality. And that is what shows up day in, day out in front of you inside your clinic. So as a cash pay provider, you have to look beyond the knee, beyond the body, and really look at why a person has come to see you and what has worked in the past and what has. And so you have to figure out what is their personality type. With these type of complex cases, they are clearly showing up. They're running all over you. They're telling what you to do. They don't listen to anything you got to hit them head on. And now, if you're struggling with that, the first step is to acknowledge that. First, great, I'm not good at those types of patients. And that's actually very fair for a lot of people, especially early in the cash-based world, because these people are used to paying for a certain experience or certain service. When they go into repair mode and they've had all this trauma and they've had previous surgeries and injections and everything else, think about the medical system has really allowed them to go, different paths and allowed them to control the relationship. And so they're seeking it out, but they can't say it, and they don't know how to say it because they've never asked for that, but they clearly are looking for a solution. So if you're looking to win over these tough patients, you have to first start with going face-to-face head on. So having that discussion, outline what you're going to say. Mr. Jones, I appreciate that you've been here and we've committed to blank amount of sessions. In order for this relationship to work and you need to maximize your outcomes, you're going to be here for 20 visits. And during those 20 visits, I need you showing up 5 minutes early. I need you being able to show the whole time and not be on your phone. Now, if you're going to do that, it's going to make it very difficult for me to be able to help you. And I need you to understand that from the very beginning. And some people aren't used to that. But the minute you do that, you're in their respect. And they're absolutely going to turn off their phone, put that down. All eyes are on you and they'll be invested in that. Why? Because you've shown them that you have the audacity to be able to do that. And once you win over one of these tough patients, you realize it right from the beginning on the initial evaluation. And that's where you win as a cash-based physical therapist. As you work in cash more and more, you'll see that these people come into your schedule. Now, you might have experienced this in the past, maybe insurance-based or early in your cash-based days. And you ever really thought about addressing somebody by what their personality is, because you've always done it by the region or the body type or the activity level? Well, those don't dictate how frustrated they are and how to conquer this for the long term. So if you're looking at managing more cash pay patients for the long term and you getting customers who are willing to commit and do the work, you have to be willing to have this conversation. So in order to win them over, you have to hit them head on. Once you've established that, now you might have to have a little bit of tune-ups here and there. Mr. Jones, we talked about this before. It's been 5 minutes. You're late. Mr. Jones, I need you off that phone. And you just have these, come to Jesus talks every so often. And that's okay and that's normal. But that allows you to have the authority in the relationship. Anytime that you're a healthcare provider, yes, you are partnering as a relationship, but ultimately, in order to have this be equal, you need to come up top and say, hey, this is what I expect from you. That'll set the tone, have a couple more tune-up talks and conversations, and then allow them to have the maximum outcomes. And you're not doing this for anything else than help somebody beyond what they've been able to get through on their own. So there's no need to, discharge them or give them more exercise or give them less or make it easier. These tough conversations are what's needed, and that's going to be the difference between you being successful long-term or only with a subset. You have to be able to treat everyone. And if you're used to a traditional, somebody who's amiable to everything that you've done before and empathetic, and they're obviously going to listen to you all the time, that's not going to happen. So the missing gap is there's probably 20 to 30% of patients that you're seeing that are just running all over you that you can't just seem to get a hold of and gain some control back inside your own business. So if you're looking to thrive and improve clinical outcomes with tough patients, this is where you need to start. Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.